Hello, my name is Dr. Joe Troncale. I've been asked to make this video for a number of groups who are interested in learning more about addiction. My background is in family medicine. I've been a doctor for about 35 years. My past 20 or 25 years have been almost exclusively involved with addiction medicine. I'm certified by the American Board of Addiction Medicine as well as the Board of Family Practice, just to give you my credentials. I've been working in the field of addiction as a medical director for 3 different addiction treatment centers. So I just needed to give you my street cred when we started this video so you would understand where I'm coming from. I've been talking to audiences for years and years about what addiction really is, and I'm hopeful that what I tell you today will be helpful to you if you are working with people who suffer with addiction or with substance use disorders of any type. My main thing that I wanted to talk with you about today has to do with brain structures that affect addiction, because I want you to understand that most people think of addiction as either a moral failure or something that people can control, something that people have sort of brought on themselves, etc., etc. What I need you to understand is that certainly everyone who starts to do addictive substances, at the time that they begin to do addictive substances, more or less are likely to not have done it with the idea that someday they would be addicted. But once someone has addiction, there really isn't anything that they can do about the addiction. What they can do, though, is learn coping skills to begin to not use the substances. So I want to talk about that with you. The subject always boils down to this whole thing about the brain, and whether you want to call addiction a disease or not doesn't matter to me, but what I do want you to understand is that people who suffer with addiction have a different brain structure than people who don't suffer with addiction. Let me explain that. There's a part of your brain called the limbic system. The limbic system, basically, limbus in Latin means edge, and the limbic system, or the limbus of your eye, is where the dark part of your eye meets the white part of your eye, because that means edge. The limbic system of the brain is where the top of the brain basically meets the bottom of the brain. This structure called the limbic system is present in all types of animal creatures, whether they're reptiles, amphibians, mammals, all that sort of thing. The lower functioning the animal model, the more prominent the limbic system. So as humans, we have a limbic system, but we are able in large part to have some control over the limbic system because we have all of this other part of our brain that allows us to be logical and to be trained and all that sort of thing. I always ask audiences if they've ever had a pet lizard, because a lizard has nothing but limbic. And what I always ask them is what they got out of the relationship with the lizard, which is nothing, because all a lizard does is eat, sleep, feed, reproduce, etc. And so in the human brain, the limbic system is made up of a number of different structures, and I'm going to go through this very quickly, because if you don't understand this, I don't think you're going to understand the addiction that goes on in human beings. If anybody's ever seen One Flew Over the Cuckoo's Nest, that movie with Jack Nicholson, what you would have seen was he got a prefrontal lobotomy in the movie because he was acting up, he was in a mental ward. And in the old days, when they couldn't control people because they didn't have medicines and that sort of thing, they would basically stick a knitting needle through the eye structure and wipe out the front part of the brain. The prefrontal area has everything to do with your personality. It has to do with risk-taking behaviors, all these sorts of things. The second part of the limbic system has to do with the anterior cingulate gyrus. And this part of the brain has everything to do with what we now know as bipolar, autism, all these sorts of abnormalities in mood and in processing and those sorts of things. The next part of the limbic system is the nucleus accumbens, and this is the pleasure center of the brain, and this, along with this other structure I'm going to talk about, has everything to do with addiction from a medical standpoint. The nucleus accumbens is the pleasure center of the brain. If you stick a transducer in the nucleus accumbens in an animal model, and you allow the animal to press the bar so that the nucleus accumbens will be stimulated, they will stimulate the nucleus accumbens until they drop dead. That sounds a lot like addiction to me. The ventral tegmental nucleus in human beings is a storehouse for dopamine, and when substances of abuse are used, dopamine is released to the nucleus accumbens. The hippocampus is part of the limbic system, which has to do with memory, and the amygdala is part of the limbic system, which has to do with rage, sex, and trauma. We'll get back to these structures, but I need you to understand one thing. If we were to measure the dopamine in this ventral tegmental nucleus accumbens, what you would see is if someone had just eaten a meal or was doing just fine or was watching this video, the dopamine in this part of the brain would just be rocking along. If we were to pass out cocaine, heroin, alcohol, nicotine, whatever, and we were to measure this after the person used those substances, what you would get was a big spike of dopamine. And if they used again, they would get another big spike of dopamine, etc. Now, this is without a doubt pleasurable. So these dopamine spikes cause tremendous pleasure to the animal or the organism or the human being or whatever. Now, here's what I want you to understand. If you don't hear anything else I say about this tape, I need you to get this. In about 10% of human beings, what happens is they have a gene, and if they're using substances, what will happen is this dopamine system in this part of the brain will come off the tracks. And what you'll see is that they will use the substance, and then the dopamine is not able to re-regulate as it used to. As soon as this dopamine drops off the face of the earth like this, the person has an automatic compulsion to want to use more substance. And it's powerful, and it's visceral, and it is irrational. And so what I need you to understand is that once this occurs, and this occurs sometimes to people 6 months after they start using, 5 years after they start using, 20 years after they first start drinking or something along those lines, what will happen is that if they have the genetic predisposition and this happens, by definition, they have addiction. And this is irreversible in the sense that every time they use substances or they use their drug of choice or whatever, they're always going to have these dopamine deficits. Now, if they stay away from substances, over a period of time, this can re-regulate. That's the good news. And it usually takes several months to a couple of years for this thing to re-regulate in people who have developed addiction. But if they go back to using, they go back to ground zero here, they do not pass go, they do not collect $200, and this dopamine level will drop back off again. That's why people relapse. They use, they believe that they're going to be okay, but they go ahead and use, and then their dopamine levels go back down, and then they start using compulsively again. If you understand this, as far as I'm concerned, you basically understand the physiologic part of addiction. The reason that I put in all these other parts of the limbic system is they are important. If you, for instance, have something that affects your mood, say you get into a fight with your significant other, your spouse, etc., what will happen to this part of the brain is this dopamine system will start to get dysregulated. The hippocampus has everything to do with memory, and if you start speaking about times when you use substances or when you use drugs or when you went to the bar or whatever, then you start conjuring up those memories and that sort of thing, this part of the brain, again, will start to dysregulate. If you were somebody that suffered trauma, and many, I would say 80% of the patients that I take care of have some significant trauma. Once you're re-traumatized, again, this is hardwired into this system, and this dopamine system starts to dysregulate. This system also is tied in with things like mental health issues such as schizophrenia, depression, bipolar disorder, etc. It's important for this system to be properly treated so that people with addictions can properly be able to re-regulate this. Now, we can continue to go on in and talk about this, because if anybody's familiar with 12-step recovery or with other programs that try to help people with addiction, what you would understand is that 12-step recovery is nothing but a way for people to keep this limbic system basically under control. If you're familiar with 12 steps, part of the 12 steps are things like making a fearless and searching moral inventory, things like making amends to people that you've hurt, all these sorts of things which are basically anti-limbic. And so everything that we try to do to help people with addiction is to try to keep this limbic system under control so that they don't dysregulate their dopaminergic system. And of course, we try to help people learn coping mechanisms so they don't use their emotional system to trigger them to go out and try to escape their feelings and start drinking or drugging. I'm going to do another video here in just a minute to show you this is the physiologic side of addiction. I'm going to show you the psychological side of addiction in the next video. Thank you very much.